This is Dr. Eric Fishman at the New York State Society for Anesthesiology PGA meeting in New York, and I'm here with Scott Hanslick, Business Development Consultant for Medical Management Resources in Syracuse, New York. And Scott, thank you for taking the time.
Thank you.
I understand that you've been with this company for about 3 years, but they've been in business for 25 years. Tell us about the evolution of what they were doing 25 years ago and what they're doing now.
That's a great question. The company's come a long way since 1986 when we were first founded. The company was started by a former administrator at the SUNY Upstate Medical Center.
I almost went there.
Really? And he brought with him 3 people and himself, so there were 4 people, and we had just a handful of accounts. And over the last 25 years, through a number of different efforts, but mainly because of outstanding service and word of mouth, our company has grown to include not only those original 4 employees, but now we have about 150, and we've taken it from those first handful of accounts to providing revenue cycle related services to over 1,000 providers across all medical specialties.
So Scott, you started in Syracuse, and tell me about your clients. Are they mostly in the Northeast, or are they more well distributed?
Well, majority of our clients are in the Northeast, and of course, we're not limited by geography. Based on all the technology that's available today, we can work with clients throughout the country. Starting as a small business in the Northeast, that's where the majority of our clients have come from. In the greater Syracuse and central and upstate New York area, and since then we've expanded down into New York City, in the tri-state area. We have clients in New Jersey and Connecticut, and all the way down as far south as West Virginia at this point.
And you're here at an anesthesia meeting. Tell us about your specialization within the anesthesia market.
That's a good question. Again, our company is unique in that we have 3 different departments, one of them being anesthesia, and in that department those folks are solely responsible for managing the receivables of our anesthesia provider accounts. So in that department, there's uniquenesses in terms of how we're gathering information from the hospitals, what information we're then providing to the administration as well as the physicians in terms of their revenue, the financial success and productivity of their practice. So it's unique in terms of the specifics in the way that we have to submit the bills, the different requirements of the different insurance companies as it relates to anesthesia. And we have a whole department that's trained and really experts in terms of managing anesthesia receivables.
Very well, and I guess many analysts in this industry would say that the AIMS, the Anesthesia Information Management Systems, that industry is taking off a few years after the electronic health record industry. How do you see the adoption of AIMS, which I think is imminent? How is that going to impact your activities?
It's actually going to improve our process quite a bit, I believe. The more information that we can gather electronically, the more efficient our process becomes. The more efficient our process becomes, the more cost savings we can pass along to our clients.
So do you anticipate that if an anesthesia group were using one of the top tier AIMS products, that your billing service fee would go down because of that?
There's a potential for that. I think the most likely impact it would have would be an increase in collections based on the not only the efficient but the more accurate collection of information, as opposed to the chicken scratch scrawl of most physicians. We'll be getting clear and concise data from these AIMS systems and feeding it electronically into our billing system. So they would see an increase in collections, thus improving the financial performance of the practice.
Do you currently interface with most of the current AIMS?
With the clients that we have right now, there are a couple that are on them. As we bring more clients on, each scenario is unique. So we're interfacing with hospital information systems, and we're also interfacing with some AIMS systems as well as other mobile charge capture devices, electronic health records, etc.
Scott, thank you.
Thank you very much, Doc.
This is Dr. Eric Fishman, and I've been speaking with Scott Hanslick from Medical Management Resources. Thank you.